Do you know, aside being antiplatelets, clopidogrel has been shown to have neuroprotective effects, and hence studies have demonstrated its potential use in Alzheimer's disease. Alright, welcome to my channel. Today we'll do a concise drug narrative on clopidogrel. We'll talk about the mechanism of action, some pharmacology, and then important, useful clinical information for our patients, our students, and other healthcare professionals. Clopidogrel is an antiplatelet, meaning they prevent platelets from activating and aggregating, hence preventing clot formation. And for that matter, they are useful in the prevention of atherothrombotic events in myocardial infarction or MI, in transient ischemic attack or ischemic stroke. And now recent studies have also suggested that it could play a role in Alzheimer's disease because of the fact that they prevent clot formation, and for that matter, they can improve blood flow to the brain. And they've been shown to also have anti-inflammatory effects, and hence can prevent neural tissue damage. They belong to a class of antiplatelets known as P2Y12 inhibitors. When we get to the mechanism of action, we'll get to know why they are called P2Y12 inhibitors. The example of these are the clopidogrel that we will discuss, prasugrel, ticagrelol, cangrelol. Clopidogrel and prasugrel belong to a chemical class. They have similar chemical structure known as thienopyridine. And what is special about these two is that they are prodrug, and therefore they will need to be activated by the liver enzyme, specifically the 2C19. So among the P2Y12 inhibitors, clopidogrel and prasugrel need to be activated. Ticagrelol and cangrelol, however, they are not thienopyridine, and for that matter, they don't need hepatic activation. They are actually active. They don't need to be activated by the 2C19. All of these comes as oral dosage form, but cangrelol comes in the dosage form of IV. How then do these class of antiplatelets work? So we'll move on to the mechanism of action. So it will be very simple. Let's consider this to be the blood vessel. Below it is a tissue known as endothelial tissue. So when there is a damage of the blood vessel, the endothelial tissue are exposed. So there will be an injury of the endothelial tissue. When this happens, they release what we call ADP. ADP will be released, adenosine diphosphate, and this will come and sit on their receptor on the platelet. So this is a platelet cell. They will sit on their receptor on the platelets, causing the influx of calcium. The influx of calcium will lead to the increase in expression of a particular protein, this protein on the platelets. This protein is known as glycoprotein 2B and 3A. When this protein is expressed, they cause the cross-linking of other platelets. They bring other platelets to join with each other through fibrinogen. So fibrinogen will link one platelet to the other. That's what we call the platelet aggregation. So clopidogrel or the P2Y12 inhibitors, what they do is they will come and bind to this receptor. And the name of this receptor is P2Y12. Hence the name P2Y12 inhibitors. They block the ADP from binding to this receptor so that this pathway cannot continue. There wouldn't be calcium influx. This wouldn't be expressed. There wouldn't be any platelet aggregation for clotting to occur. Now, let's talk about the pharmacology. We'll begin with some pharmacokinetics. The first thing we'll talk about is the absorption of clopidogrel. So clopidogrel is rapidly absorbed when you take it orally. The absorption is rapid, and only 50% of the drug will actually get to systemic circulation. So bioavailability is about 50%. 50% bioavailable. And food, it has been shown that food, especially high fatty meal, is able to reduce the ADP-induced inhibition by 9%. So when you take the medication with food, the ADP-induced inhibition is reduced by 9%. That's the degree to which the drug is able to block ADP is reduced by 9% when you take it with food. And also there's Cmax, meaning the maximum concentration that the drug can reach in systemic circulation is also reduced by 57%. These two information can, inform us that it is best, or ideally the medication should be taken on an empty stomach. So on an empty stomach for optimum absorption or effect. Because as we said, when you take it with food, the degree of ADP inhibition is reduced by 9%. So for us to get optimum effects or absorption, it's better for us to take it on an empty stomach, or educate our patient to take it on an empty stomach. But most patients, when they take it, they tend to have stomach upset. And one way of preventing this stomach upset is to take the medication after food. So two things: if the patient isn't experiencing any stomach upset, then ideally the medication should be taken on an empty stomach. But if the patient complain of stomach upset after taking the medication, it's better to be taken after eating. So we'll move on to the onset. As when you take the medication, within 2 hours, within that time is where the inhibition of ADP from binding to the P2Y12 receptor will occur. And for that matter, it's very essential to give the medication as early as possible in acute situations. When you give the drug repeatedly, it will take about 3 to 7 days for the drug to reach steady state. When we talk about steady state, it's the state at which the drug reaches a consistent level in the blood. And at that level, that's when you can actually determine the effectiveness of the drug. For clopidogrel, it will take about 3 to 7 days for you to reach that level. Or it will take about 3 to 7 days for you to actually determine the effectiveness of the medication. So this in particular is very important. You have to educate your patient that he or she should continue to take the medication the same time every day in order to reach that steady state. And we can only determine that the drug is very effective or not after 3 to 7 days. Also, when you stop taking the drug, that's clopidogrel, the platelets will return to their normal function after 5 days. So when you put someone on clopidogrel, it will take about 2 hours for it to start the ADP inhibition. The actual effectiveness will occur 3 to 7 days. And when you stop the medication, it will take additional 5 days for the medication to effect to be worn out. And this is important because if you have a patient who is going to have any surgical procedure and the patient was put on clopidogrel, one of the side effects of clopidogrel is bleeding. And if someone is to be performed surgery, we are concerned about bleeding because we'll be cutting the patient. And if that patient is on clopidogrel, it is recommended that the patient stop taking the clopidogrel. And then we expect the patient to stop taking the clopidogrel at least 5 days before the surgery can begin. And the reason is that when the patient stops taking the clopidogrel, it will take 5 days for platelet function to return to normal so that bleeding wouldn't occur. Now we will continue with metabolism and elimination of clopidogrel. So as I said earlier, the clopidogrel are extensively metabolized in the liver, and they make use of a particular enzyme known as cytochrome 2C19. The 2C19 itself is important to activate clopidogrel, convert clopidogrel from a prodrug to an active form known as thiol active clopidogrel. So they make use of the 2C19. The same enzyme also metabolizes the drug into its inactive metabolite so that it can be eliminated. So, meaning if you have a patient who is hepatic impaired, you are worried, one, about the drug being activated. You are worried about drug activation because, as we said, the 2C19 is in the liver. It's a liver enzyme, and it is that enzyme that will convert the clopidogrel to its active form if the liver is impaired, meaning the drug wouldn't be effective because it wouldn't be activated. Also, hepatic impairment will lead to increased accumulation of the drug, increased drug accumulation, and that can lead to toxicity. And our main concern is bleeding. Because it's an antiplatelet, we are concerned about it causing bleeding if there is hepatic impaired. So in an hepatic impaired patient, one of the things that we have to consider is dosage adjustments. Now to the elimination. The prodrug itself, the clopidogrel itself, has an elimination half-life of around 6 hours. So it takes about 6 hours for the prodrug to be reduced to half its original size. But the active metabolite, as the thiol active metabolite, has a half-life of just 15 to 30 minutes. So the half-life of this medication is very short. But why then is it taken once a day? The reason is that when you're taking clopidogrel and it's activated to its active metabolite, they are able to block the P2Y12. That blockage or that inhibition is actually irreversible. So even though the half-life is short, because of that blocking of the P2Y12 receptor is irreversible, the drug duration can actually be a longer time. Being able to irreversibly block the P2Y12 inhibitors In another way, it means that its duration will be only halted when new platelets are formed or when the old one dies. So even though the half-life is short, they are able to prevent platelets from aggregation for about 7 to 10 days. And 7 to 10 days is the half-life of a normal platelet. Is the lifespan, sorry, of our platelets. So even though the half-life is short, until new platelets are formed, they are still able to exert their effect because of the fact that they irreversibly block the P2Y12 receptors. So our next discussion on clopidogrel will be on the some drug interactions. And the first one, we've already talked about it in our proton pump inhibitors series. So 2C19 inhibitors interact with clopidogrel. Example of 2C19 inhibitors is omeprazole, esomeprazole. So as we said, clopidogrel is a prodrug. A prodrug meaning in this form it is not active. There is an enzyme in the liver that converts the clopidogrel to the active form. And that enzyme is 2-cytochrome 2C19. But this same enzyme, omeprazole and esomeprazole, can inhibit it, meaning they prevent it from actually working. And for that matter, if you take these medications together with clopidogrel, the clopidogrel will not be activated for it to perform its function and it wouldn't be effective. So if a patient is on proton pump inhibitors and clopidogrel, one of the best solutions as we talk about is to change the proton pump inhibitor. And one of the proton pump inhibitors that is actually favorable is rabeprazole. Rabeprazole. And this is found in Pariet. And the reason is that this proton pump inhibitor does not actually inhibit the 2C19. They don't have a significant inhibition effect on the 2C19. So when you take them together with clopidogrel, the clopidogrel will be activated and then it will work effectively. The other interaction that we can talk about is clopidogrel and NSAID, non-steroidal anti-inflammatory drugs. Example of NSAID include diclofenac, pyroxicam, naproxen, etc. There are plenty. NSAID, as we discussed, increases the risk of peptic ulcer disease. So they can increase the risk of bleeding. Clopidogrel is an antiplatelet. As an antiplatelet, they prevent platelets from what? Coming together. They prevent clot formation. And for that matter, they also have an increased risk of bleeding. Mind you, one of the side effects of clopidogrel is actually bleeding. So if you take clopidogrel and NSAID together, you increase the patient's risk of bleeding. So that combination is recommended to avoid that combination or to monitor the patient. Our last interaction with clopidogrel has to do with clopidogrel and opioids like morphine, like fentanyl, and some other opiates. The interaction between this medication and clopidogrel is that this medication, they reduce the GI motility, they reduce the peristalsis movement. And for that matter, When you take them with clopidogrel, there will be decreased absorption of clopidogrel. And when that happens, only small amounts of the medication, that the clopidogrel, will get into systemic circulation, and then you wouldn't see the optimum effects that you want to see with the medication. Our last thing that we talk about clopidogrel will be on the side effects. Side effects. These are really important that we have to monitor. One is bleeding. Because it's an antiplatelet, prevents platelets from aggregating, preventing clot formation, and therefore bleeding can actually continue to occur. And you have to actually avoid them in someone who is having an active bleeding, like peptic ulcer. Headache. Some patients, when they are put on clopidogrel, tends to develop headache. Dizziness, and in some other cases to a development of rash. Thank you. This brings us close to our drug narrative on clopidogrel. In this video, we are able to understand the mechanism of action of clopidogrel, some useful pharmacokinetics and dynamics, some counseling points, and some useful clinical information for students, for healthcare professionals, and for our patients as well. Thank you. My name is Dr. Leon. This is my channel. Subscribe.